STD rates among seniors have doubled in the last decade, and most doctors aren't even testing for them. I'm about to share 5 critical facts about sexual health after 60 that could literally save your life. The third one shocked even me, and I've been studying this for years. Many seniors are skipping protection for one surprising reason, but the consequences can be devastating. Stay with me to discover why this hidden epidemic is spreading and exactly what you need to do to protect yourself. What I'm about to share today isn't something you'll hear at most doctor's appointments, but it absolutely should be. When Janet came to one of my workshops last year, she was recently widowed after 42 years of marriage. At 67, she'd started dating again and was shocked when her new partner gave her an STD. "No one warned me," she told me with tears in her eyes. "I thought only young people needed to worry about this." Janet's story isn't unique. In fact, it's becoming alarmingly common. According to the CDC, STD rates among adults over 60 have doubled in the past decade. Yet most healthcare providers aren't discussing this with their older patients, creating a dangerous knowledge gap. In this video, I'll share the 5 critical facts about sexual health after 60 that everyone needs to know. I'll explain why this crisis is happening, the specific risks you face, and exactly what steps to take to protect yourself. Whether you're single, dating, or in a long-term relationship, this information is essential for your health and well-being. Let's get started. Fact number 1. Why CD rates are skyrocketing among seniors. The first fact might surprise you. Seniors are one of the fastest-growing demographics for new STD infections. But why is this happening now? There are 3 major factors creating this perfect storm. First, we're living longer, healthier lives. The generation that came of age during the sexual revolution of the 1960s and 70s is still sexually active well into their 70s and 80s. This is wonderful news. Intimacy is an important part of well-being at any age. Second, divorce rates among older adults have doubled since the 1990s, putting more seniors back in the dating pool. With dating apps specifically for seniors, finding new partners is easier than ever before. But here's the critical third factor. Most seniors grew up before the AIDS crisis of the 1980s. They never developed the habit of using protection. And since pregnancy is no longer a concern after menopause, many see no reason to use condoms. As Robert, a 72-year-old widower, told me, "I haven't used a condom since the Nixon administration. Why would I start now?" Unfortunately, this mindset is exactly what's fueling the crisis. Let me share a shocking statistic. In a survey of sexually active adults over 60, only 12% reported regularly using condoms. Compare that to nearly 60% of adults in their 20s. This protection gap is the #1 reason STD rates are soaring among seniors. Fact number 2, the most common STDs among seniors and their symptoms. Now, let's talk about the most common STDs affecting seniors and the symptoms you should never ignore. The top 5 STDs among older adults are 1. Chlamydia, 2. Gonorrhea, 3. Herpes, 4. Syphilis, 5. HIV. Here's what makes this particularly dangerous. STD symptoms often mimic other age-related conditions. For example, joint pain from syphilis might be dismissed as arthritis. Fatigue from HIV might be attributed to normal aging or heart disease. Even more concerning is that many STDs can be completely asymptomatic, especially in women. You could be infected for years without knowing it, all while the infection causes serious internal damage. Let me tell you about Margaret, a 73-year-old who developed what she thought was a persistent UTI. After 3 rounds of antibiotics failed to clear it up, a specialist finally tested her for STDs. She was shocked to learn she had gonorrhea, which she'd contracted from her partner of 2 years. He had no symptoms and had no idea he was infected. Here are the symptoms you should never ignore. Unusual discharge, burning during urination, unexplained rashes or sores, persistent flu-like symptoms, pain during intercourse, unexplained weight loss. If you experience any of these, please see your doctor immediately and specifically request STD testing. Don't let embarrassment prevent you from getting the care you need. Fact number 3. Why most doctors aren't testing seniors for STDs. This third fact shocked even me when I first discovered it. Most healthcare providers simply aren't testing older adults for STDs, even when they have symptoms that warrant testing. A study from the University of Chicago found that only 17% of men and 11% of women over 60 had ever discussed sexual health with their doctor after turning 50. Even more alarming, only 38% of doctors routinely ask senior patients about their sexual activity. Why is this happening? There are several factors at play. First, there's an unconscious bias among many healthcare providers who assume older adults aren't sexually active. Dr. Stacy Lindau, who studies sexuality among older adults, calls this the invisibility of senior sexuality. Second, many doctors feel uncomfortable discussing sex with older patients. They worry about appearing disrespectful or invasive. Third, time constraints during appointments mean sexual health often takes a back seat to managing chronic conditions like diabetes or heart disease. And finally, Medicare doesn't automatically cover STD screening unless specifically requested with a reason. This creates a financial barrier for many seniors. This testing gap has devastating consequences. By the time many seniors are diagnosed with an STD, they've often developed complications that could have been prevented with earlier detection. Take James, a 68-year-old who contracted HIV but wasn't diagnosed until the virus had already progressed to AIDS. His doctor had never suggested testing, despite James being sexually active with multiple partners after his divorce. This is why you must be your own advocate. Don't wait for your doctor to bring it up. You need to initiate the conversation about sexual health and specifically request STD testing if you're sexually active with new partners. Fact number 4. The unique health risks STDs pose to seniors. The fourth critical fact is that STDs can be more dangerous for older adults than for younger people. Here's why. As we age, our immune systems naturally weaken, making it harder to fight off infections of any kind. This means STDs can progress faster and cause more serious complications in older adults. For women, postmenopausal changes to vaginal tissue make it thinner and more susceptible to micro-tears during intercourse, creating more entry points for infection. For men, conditions like an enlarged prostate can mask symptoms of certain STDs, delaying diagnosis and treatment. But perhaps most concerning is how STDs can interact with common age-related conditions. Untreated syphilis can cause cardiovascular damage, compounding existing heart conditions. HIV can accelerate cognitive decline in those already at risk for dementia. Certain STD medications can interact dangerously with blood pressure or cholesterol medications. There's also emerging research suggesting that some STDs may accelerate the aging process itself by increasing inflammation throughout the body. Barbara, a 71-year-old with well-controlled diabetes, contracted herpes from a new partner. What would have been a manageable condition in a younger person triggered a cascade of complications that led to hospitalization due to her compromised immune system. This doesn't mean you should avoid intimacy, quite the opposite. Healthy sexual relationships contribute significantly to quality of life as we age. But it does mean you need to take precautions and get regular testing if you're sexually active. Fact number 5. How to protect yourself and have the conversation with partners. Now for the most important part. Exactly how to protect yourself and have these sometimes awkward but necessary conversations with partners. First, protection basics. Condoms are still the most effective way to prevent most STDs. Yes, even if pregnancy isn't a concern. Dental dams can be used for oral sex protection. Water-based lubricants are important for comfort and preventing micro-tears that can increase infection risk. Next, testing protocols. If you're dating or have multiple partners, get tested every 6 to 12 months. If you're in a new relationship, both get tested before becoming intimate. Even in long-term relationships, consider testing if either partner has had previous relationships. Now for the conversation strategies. I know this can feel uncomfortable, but here's a simple script you can adapt. I'm really enjoying getting to know you, and I'm attracted to you. Before we become intimate, I think we should both get tested for STDs. It's something I do with any new partner because health is important to me. Would you be comfortable with that? Remember, anyone who reacts negatively to this reasonable request is showing you something important about how they view your well-being. For those in long-term relationships where one or both partners may have had other relationships in the past, try, I recently learned that STD rates are increasing among people our age, and many infections don't show symptoms. I think it would be wise for both of us to get tested, not because I don't trust you, but because I care about our health. These conversations get easier with practice, and they're a sign of respect for yourself and your partner. We've covered a lot today, from why STD rates are rising among seniors to the specific risks you face and how to protect yourself. Let's quickly recap the 5 critical facts. 1. STD rates among seniors have doubled because of longer lifespans, more dating, and less condom use. 2. Common STDs often mimic age-related conditions, making them easy to miss. 3. Most doctors aren't testing seniors for STDs, so you must advocate for yourself. 4. STDs can be more dangerous for seniors due to weakened immune systems and interactions with other conditions. 5. Protection and honest conversations are your best defense. This hidden epidemic doesn't have to include you. With the right information and precautions, you can enjoy a healthy, active sex life at any age. If you found this information valuable, please share this video with friends who might benefit. And if you have questions about anything we've discussed today, leave them in the comments below. I read everyone. Thank you for taking this important step toward protecting your health. Remember, knowledge is power, and you deserve to enjoy this chapter of your life with confidence and peace of mind.